Hello and welcome to Who's to Blame for Sprains and Strains. I appreciate you staying with us. We had some technical issues that were going on the backside, so hopefully all of those will get worked out before it's time to bring all of the speakers in. In case we haven't met, my name is Holly Foxworth. I'm a registered nurse and I am the marketing manager for content here at Axiom Medical. And I have a fantastic panel that I'm holding my fingers together crossed that they're all going to be here momentarily, but that's going to include Dr. Scott Cherry, who is our Chief Medical Officer. We have Dara Wheeler, who is our Chief Marketing Officer. And then we also have brought in Tomm Gilliam, who is, he is from what used to be the ICPS team, but now they've changed their name to DataFit. So you're going to hear lots of great information from Tomm. I do have some exciting news to tell you, and what you're looking at right here, if things look a little bit different, it's because they are. It's not because your eyesight has changed there. We've made some enhancements to our console here to get some additional information, to share additional information, and get additional information from you about what's important to you, what you like to see, etc. So let's just talk about what you're looking through right now. So on the right-hand side at the top, all of that stays the same, and that's where you'll RSVP for your invite for next month's webinar. That one's going to be with Dr. Curtay, and so he's going to do a special on faking it, and we're going to be talking about imposter syndrome. So by the time all these kids have gotten back to school, we've all gotten hyped up for the holidays and everything else, and all of a sudden we're starting to think, oh man, am I really a failure? Is this really what's going on with me? Am I the only one that's thinking this way? So if you haven't already, press that blue RSVP button, and that will get you signed up for next month's event. You don't want to miss it. The next thing I was going to mention was we've added a survey to the console. So you'll see that at the bottom. We would just ask your thoughts there. So it'll ask you about, how did things go today? What do you want to hear in the future? So we look forward to what your input is there. And then I think the one that we're probably most excited about is the emoji engagement tool that's there. So if you want to give us a thumbs up, you can give us a heart, you can give us funny faces, whatever you want to give us. That one is at the very bottom of your screen, right down there on the right-hand side. So hit those emoji buttons and let us know how you're feeling there. And then the last one I'll tell you about is the gift generator, also known as the question and answer box. So I want to hear what you have going on. This is always a safe place to talk. If you have a question, anything you want to know, and please put those questions in there. And I do like to send gifts at the end to those that, oh, I see some emojis already. I like it. Okay, and then last thing, NSC is coming up. It will be here in less than 12 weeks, I believe. So if this is going to be in New Orleans, it will be October 23rd through 25th. If you don't already have plans to attend and you would like to attend, you need a free pass, put your name in the comments section, and we will make for sure that Brittany reaches out to you and get you a free expo pass. All right. Well, let's go ahead and meet our presenters. We'll start with, how about we start with Dara? Dara Wheeler, let's start with you. I'll let you introduce yourself, and then we will go to Dr. Cherry next.
Okay, great. Thank you, Holly. Welcome, everybody. Thanks for bearing with our new technology here, and we're seeing all the responses come through, so thank you all for participating. And hopefully you can join us at National Safety Council in October. We love seeing all of you out there. And New Orleans is always a fun city to visit, so hopefully we can see you there. And if you want a pass, like Holly said, reach out. My name's Dara Wheeler. I'm Axiom's Chief Marketing Officer. I'm over marketing and product at Axiom. So all of the interactions that we have with customers, I love hearing from all of you how we can make our products better, how we can improve what we do, or collaborate better with our clients. So I'll pass it over to Dr. Cherry.
Awesome.
So good afternoon, everyone. My name is Scott Cherry. I'm Axiom Medical's Chief Medical Officer. My professional background is I'm board certified in preventive medicine, public health, and occupational environmental medicine. I've been supporting industrial, corporate, and military operations for about the past 15 years, and it's a pleasure to be with you today. And I'll pass it on to Dr. Gilliam.
Awesome. Tomm, can you hear us? We may not can hear you at the moment. We can work on it. Let's see. All right, while we're working on that piece, then let's go ahead and move on. So I do have a poll question to start out. Before we even get started, I know we're not talking COVID today, but this has been a topic that's been coming up a lot. So let us know. We're going to cover this at the end. We've asked Dr. Cherry to give us an update on everything, all things COVID and what's happening right now with the most recent variant that's there. So let us know. Somebody I know has COVID at work, home, at school, yes or no? And we will answer that and give you an update then towards the end. So to give you an idea of what we're going to go through today, we're going to talk through proactive, but then also what your defensive strategies is for sprains and strains. So we're going to talk about the impact. We're going to talk about data trends, talk about some of those proactive measures. Hopefully Tomm will be able to hear us there. And then also we'll talk through what your best defense mechanisms are and how and when and why some of these first aid measures actually work. So Dara, I'll go ahead and get started with you. Who's to blame for sprains and strains?
I know Holly's got a nice little picture here of water guns and Nerf guns, and I think she's setting me up for a funny comment here, but I do think it's an interesting thought about who is to blame here, and all of our safety professionals out there. I know they try to engineer amazing safety programs to prevent all injuries. But I know when I talk to our safety professionals out there, they all recognize that as long as we've got humans working, it's going to be hard to prevent everything. And we've had lots of interesting stories over the many years. So I've been here 17 years, and I can tell you a lot of pretty interesting and amusing stories. And one of my favorites, we work with a lot of oil and gas clients and on rigs, and they called us in a case one time, and there was a bear chasing all the guys on the rig, and they called Axiom and said, help. Well, if you sprained an ankle running away from the bear, I don't know that we could have engineered a process to prevent that bear from chasing everybody. So I think we're all responsible and looking at creating programs. And I know we're going to talk a little bit about really kind of where this comes into play from an employer standpoint, and employees, employers, and all of us involved, and what roles we play within this. But I'll go ahead and leave it there.
Awesome. Well, let's talk through the impact here. So if you're looking at the injured employee, the employer impact, then you're also looking at the business impact. Those are three different experiences. Talk to us about the three of those, Dara and Scott.
I'll kick it off and kick it over to Scott then. Like I said, we've got this sprain strain impact between an injured employee, the employer, and the business impact. I'll just say I think that from everybody involved, of course, we're all in the business of trying to prevent employees from being injured in the first place, because when employees are injured, there's so many downstream effects of that injury for the business, for the employee, for their community, for their family, and for the rest of the employer and the business. So I'll kick it over to Scott to talk a little bit more about the details of the impact.
Sure. Thanks, Dara. So when we look at the actual employee who's injured, obviously there's going to be a physical injury with all the resulting symptoms of pain, discomfort, swelling, reduced mobility. And so really that's the kind of the direct impact to the person, but quickly that affects their quality of life, namely their work performance. They're thinking, can I perform my job? Can they perform their hobbies? Can they interact with their family? Et cetera, et cetera. So, it can be very concerning to where it may and probably does add additional emotional stress to them. And so, and probably a big component of that is financial, right? If someone gets injured on the job, they are thinking about how does this affect my work just from a financial perspective, and when can they fully recover and be rehabilitated? How long is this going to take? A lot of injuries are usually mild and have full recovery. There's a continuum of a small percentage of injuries end up becoming chronic or long-term. And so really there's a concern about, is this a long-lasting impact into the work capacity? Now, when we branch out to the employer impact, obviously there's productivity loss of that employee being affected, and it may have direct and indirect costs to the employer. Obviously, there's going to be expenses with regard to the actual injury care, but a lot of indirect expenses with a disruption in efficiencies, teams, or just a direct relationship from that injured employee. Potentially, it can affect the morale of the workforce, as well as the reputation of the employer. So, these are very complicated components of an injury, but again, something to think about. And lastly, training or potentially accommodation expense. And then when you think about just the overall business impact, it's really a further extension of the employer impact. But again, you're going to have some type of operational efficiency disruption, potential effects in quality of products and services. And I think for some of our clients, they're especially affected by OSHA recordability and TRIR rates. And so that can have, huge business impacts for that specific company to bid for work, for larger jobs and things like that. And, Dara, as you were speaking on that last slide about, who's responsible, I've thought about it a lot. And, obviously it takes it's a team approach. Everyone is really responsible. And like you said, a lot of safeties and supervisors are really trying to ensure there's a safe work environment. And so obviously you need a safe work environment, but there's also individual responsibility, kind of like how we see professional athletes. If they want a long career, not only are they training to be excellent with their skill and in their sport, but they're doing a lot of preventive measures like stretching, weight training, nutrition, meditation, just so many things out there to where we're seeing professional athletes being able to work in their sport for decades now. So I think that extends almost really to the worker, where if you're not doing preventive type of approach to your overall health, that can also be a weak link. And I know Tomm has some data on that will be very insightful as well.
Yeah, definitely. Yeah. And the other thing I was thinking about too, Dara, whenever we're speaking with people, how many times have we heard them say, what is it that we can really do about sprains and strains? We've heard so many times that the OSHA records, that there's so many events that are happening with the sprains and strains that are there, that it's taking over. It's not necessarily that they have necessarily an unsafe work environment, but you have your records don't reflect that simply because of sprains and strains. Are you still hearing some of the same feedback there, that speaking with clients about that as well?
Yeah, and I know, like Scott said, Tomm's data will go into kind of the overall preparation we're seeing from employees and their own responsibility. We think a lot about holistic health of employees, and one of the key areas we've been looking at in our own data is comorbidities and the underlying conditions that employees come to work with. We talk a lot about employees coming to work with their whole selves, and that's becoming more and more critical mentally and physically. And I think we've talked a lot about this on a lot of our webinars, where this dichotomy between mental health and physical health is probably kind of a bit of a false dichotomy. And we really think about this whole person coming to work. We know that a lot of employers out there have drug and alcohol programs and various other programs to prevent issues in the workplace, because they're trying to look out for the safety of the team and the employee. But when we look at things like underlying health conditions and employees being able to come to work healthy, and prepared and able to perform their job duties. One of the areas that I know a lot of the safety teams that we work with are really focusing on is psychological safety, because if you are coming to work and yes, you may be able to kind of physically perform the job, but if you don't feel comfortable talking to the team about preventing injuries, safety risks, feeling comfortable raising these issues, then we're missing a component. And that psychological safety is a virtuous loop of being able to kind of prevent injuries from happening, but also report things if they are occurring. So when we look at the data, we're seeing a lot of indications that there's a positive relationship between reporting more injuries, which seems counterintuitive, without having this preventative component too, because of that virtuous cycle of psychological safety and then safety.
Yeah, definitely. Did we lose Tomm? Tomm, are you available? We may have lost Tomm. Scott, I may get you. Yeah, I may get you to speak on some of Tomm's and get him started here until we can get him back in. But in terms of declining strength of the worker, where do these trends look like, and how does this impact what the sprains and strains are?
So I'll try to do Tomm a little justice. I know he would do a much better job, but I've known Tomm now for probably 4 or 5 years, and he's his company DataFit. They've been in this business for decades, where he provides large scale functional capacity evaluations, and so he has his own internal data for what's been going on for. I think might be hearing Tomm come on, so I must be doing a terrible job. If I can get him to get online, that'll be good.
Well, it took a phone to do it. As opposed to,
oh, okay, yeah. All right, we'll take it.
I apologize to everyone that I'm not too techy and couldn't quite figure out how to do the volume. So
that's okay.
I've been listening. I've heard you all, and so far so good. So how can I help?
Well, talk to us about the declining strength of the worker. We'll let you pick up there.
Okay, sounds good. As Scott was saying, and Dara, you, Holly, my training background is I have a PhD in exercise physiology, muscle physiology. Been doing muscular strength testing in the industry for a number of years. And like Scott was just saying, we have a huge database of over 600,000 industrial strength tests. And I've been tracking it for years. And what's disturbing to me is that the worker is getting weaker every year. And it's about 1% weaker every year. When COVID kicked in, that number jumped to about 3.3% loss of strength with the worker annually now for the last couple of years. Big loss in strength in the upper body, and that's also where we see a tremendous increase in shoulder strains and sprains. I know that you all were talking about it earlier, that there's a number of ways to prevent these strains and sprains. But one of the factors that somehow gets overlooked all the time, in my opinion, is the human factor. We make a lot of ergonomic changes, which is good for the worker, good for the workplace, but you still have not done much for the worker. As this data shows here on the left-hand side, looking at changes in shoulder strength, since 2013 versus 2022, looking at about 31,000 evaluations in 2013, about 29,000 plus in 22. By age groups, ironically, the gap in strength for the upper body strength, shoulder strength, is the greatest at that 20 to 29-year-old age group, which is not very encouraging, knowing that the young worker coming into the workplace is really doesn't have the strength that a 30 to 35-year-old would have. And when you look way out at greater than 60, I wouldn't put too much faith in those numbers. It's a small number, about 600 or 700 people, so you can't really statistically take a look at that. But you can see there's a difference, the orange line being 2022, the blue line being 2013, and if I had 2005 up there, 25 up there, the blue line would be another line above the existing blue line. So the worker has been losing strength every year, sadly, and it's not just because the worker is not taking good care of themselves, which is part of it, as you know, but also computerization at the workplace, robots and things like that has taken the physical aspect out of a lot of the physically demanding jobs that stimulated the muscle and kept strength at the workplace, and so that's a big loss. But in general, as you all know, the health of the worker today just is not good. If you look at the knee strains, you can see the same thing. That today in 2022, the worker is a lot weaker than what they were back in 2013, and this is going to have an impact on strain sprains. As we look at strain sprains over the years. It's still the number one, number two, number three cause of injury in the workplace. That goes way back in the 1990s. That hasn't changed. And yet we've made a lot of ergonomic changes, all for the good, as I said earlier, and it still hasn't changed. And I believe that one of the contributing factors is this loss of strength. And we still don't deal with that human factor in the workplace, and we need to do that.
Absolutely.
Hey, Tomm, I might have a couple of comments or questions, maybe if I'd like to just interject real quickly. I think as a physician, I've been aware of, like, as we age, a person will lose, strength and muscle mass as they age. Your data has always been compelling to me because you're able to look at data sets over decades, but at the keeping age at the same or looking at the same age groups. And so what I see here is, whether it's for the shoulder or for the knee strength, essentially from 2013 to 2022, it looks like a significant weakening of knee and shoulder strength, keeping those age groups stable. And so, we're talking about sprains and strains today. So when I think of a strain, that's usually a muscle that's been injured, and then a sprain is really a joint that's injured, like so a tendon is for muscle to bone, and then a ligament is really over a joint. So you can kind of lump them together. But what I think is interesting here is, for strains specifically, the weaker you are, the more susceptible you potentially are when you're pushed to your max lifting capacity or beyond your max lifting capacity. Has your data shown that at all, about strength and propensity to getting injured in the workplace?
Yes, Scott. Some clients we collect loss run data, and we do see, when we get the loss run data, we can go back to see how the individual tested on the machine. And I know a couple of people have asked questions, but I'm talking about how we assess strength. We assess strength on an isokinetic testing device, where we do shoulder flexion extension, knee flexion extension. But yeah, as that weakness continues year after year after year, they're seeing more and more strains to these joints, and sadly, they're severe. A shoulder injury today, as I mentioned earlier, I believe that many industries are now reporting that's the number one strain in the workplace, and that's a costly injury. And some of our clients have reported that the shoulder strain is more expensive today than the low back strain, and they have more. So, I've looked at all the changes that companies have made from an ergonomic point of view. Again, very positive, very good on that, but they still have not taken into consideration the fact that the worker is weaker today than they've been previously, and they continue to get weaker. COVID had even a more dramatic loss of strength as a result of the lockdown, and this is contributing to it greatly. And I know companies. I hope companies will begin to do this more and more, But this is where strengthening exercises during the workday makes a great deal of sense, and it's easy to do with various bands and things like that right at the work site. But the question that company has to ask is, are they willing to allow that worker to do that? If not, they're going to continue to see a decline in strength and an increase in strains, particularly for the shoulder region. This is our COVID data. Looked at about 22,000 people in 2019 versus about 25,000 people in 2021. And if you compare it back to 2005 and 2019, the worker on average has lost about 1% of their shoulder and knee strength every year since that's a 15-year span. During COVID, on average, they lost 3.3% per year during that period of time. Same type of workers, same type of jobs. And so we're anxious to look at our data here at the end of 23 to see if that tremendous loss increase of 3.3% continues. The worker has also gained on average about 0.5 of a pound from 2005 to 2019. During COVID, they gained on average 2 pounds per year. And you know, it's a combination of loss of strength, increased body weight. That combination is not good for strains and sprains. It goes back to the Duke Medical University data in 2007 by Ostaby when he showed that the average, the soft tissue injury, strains and sprains, if you had a BMI, a body mass index of 35 or more, you had 2.5 times greater the risk for strains and sprains, 7 times the cost, and 13 times the lost work days. So gaining the weight and losing the strength is a bad combination. And also when we looked at strength to body weight ratio, which is a good measure from a performance point of view, it's been around in athletics for 40, 50 years. And that, if you have a high value there, that means you have good strength relative to your body weight. If you have a low value there, that means you have poor strength relative to your body weight, which puts you at risk again for these strains. Prior to COVID, that number was decreasing, which is bad. 0.9% during COVID. It decreased about 4%, and that was because of the loss of strength, increase in weight. And then the BMI, that category of 40 or more, which is morbid, and we now look at the category of 50 or more, because we see that many more people in that category. That used to be increased about 5% per year into those 40 and more category. And during COVID, that was about a 10% increase. So the health of the worker is not good today. Yes, we can make all these changes in the workplace, but if you don't take into consideration that human factors, there's these injuries, and they become more severe and more significant, cost, lost work days, and so forth, will continue.
So, Tom, we had some questions that came in specifically about some of the data. One, Michael was asking, I've been told that weak legs are a huge contributor to back problems because of the compensation that the person has to make a lift, and was asking for your thoughts.
Agreed. There's a dramatic connection between the shoulder and low back injuries. We have seen that. There's the old cabling effect. We a lot of our muscle feeds down into that thoracolumbar fascia, and if you have strong upper body, strong legs, that's why you've always told use your legs when you left. Once you connect that fascia, that connective tissue, as you connect the muscle, that becomes taut, and that protects the low back. If you don't have the strength to begin with to allow that to happen, you still do the task, but now you're at risk for injuring that low back. For example, we work with a major airline. We do all their ramp workers. You can't crawl into the belly of an aircraft and ergonomically do that, the lifting of the suitcases correctly, because in most cases, unless it's a huge plane, you're on all fours. And so when you reach out to have that suitcase, which could be 10 pounds or 70 pounds, if you don't have adequate shoulder strength, that puts a tremendous amount of pressure on the low back, and that gets injured, not the shoulder. And now we go in and rehab the low back, and we get to strengthen the shoulder, and so the injury reoccurs again 6 months down the road. So yeah, strengthen the legs, strengthen the upper body, protects the low back.
Okay. And then I'll open it up to Scott and Dara as well. We had some other questions that came through. Megan was asking, and I thought it was a great question. Do you have any recommendations on how we can motivate workers to adopt healthier habits outside of work so that they're less likely to have incidents when performing their jobs in the workplace? What a great question, and I think that speaks to the heart of a lot of injuries that take place. Any thoughts there from any of you?
I can start off there and maybe pass it to you. So I think there's not like one thing that has been shown to be the kind of the complete solution here. So it's probably a mix of awareness with education, mindset, mindset approach, visualizing what the value is of optimizing your health. What's interesting is what we're gaining here from Tomm's data is really about the decrement to the performance on the job, but I think there's as much data or more for your own, for your personal quality of life, right? Engaging in hobbies, engaging with family. When I was seeing patients, I would kind of use a tactic depending on who's in front of me about visualizing the next 10 or 20 years, whether they're a family man and starting out with a new family, thinking about their kids' wedding and grandkids, et cetera, because you want to maximize your longevity, but also your health span to where you're as functional as possible late in life. But I haven't come across really a magic bullet, so to speak. But I think if you can show kind of multiple values from optimizing each individual's health is really the way forward. I don't know if Dara, you have any other thoughts? We think a lot alike, so I know I might have taken some of yours.
I have a lot of thoughts. Yeah, I think you're right. Programmatic design of this really is the way to go in terms of multiple areas of impact. I do think it's not one thing. I agree with Scott there. I always think a lot about motivation too, and I think I was talking to one of my team members last week, and we all know that we can't necessarily improve our own motivation or others' motivation to show up and do something to improve. But when we think about behavior modification, it's exactly all the things that Dr. Cherry was talking about in that, visualization and understanding bigger picture, but even just taking every single day and understanding what can I do today? How do I change today to be better for today? I think humans, we don't tend to do very well when we try to make changes for 5 years from now. But if we can make changes for today, for this hour, then I think we can potentially make some really better long-term behavior modifications. But I do think that's why, even at the beginning when I was talking about holistic approaches to these things, it can't be one thing. It has to be a program design or a holistic approach to this. And it's not an easy answer. So unfortunately, it's like one of those simple, not easy conversations.
Yeah, there's a lot of questions here, and let's move on with them because I think that we may pick them up right here in the next section. So basically what we want to talk about now is your defense. Sometimes you can't prevent all of these things, but you can impact what your outcome would be whenever they occur. And so what I wanted to have Dr. Cherry do is not push this model on you, but just to say, this is how that we do it. And if you don't have somebody that already does this, if you don't already have a model that's there, you may want to consider something like this. And then we'll go through some of those first aid measures that are so key to making some of these, to getting those impacts and those outcomes that you're really wanting for.
Yeah, thanks, Holly. And, our experience at Axiom when we're consulting with a potential new client and we look at their distribution of injuries and how they're dispositioned based on first aid or needing medical treatment beyond first aid, what really strikes us is most clients who are not actively managing their injuries have a hugely skewed distribution of injuries that go well beyond first aid, even if really the injury itself would be considered minor. And so our internal data for the performance of our incident case management service, we usually can keep between 60 and 80% of injuries at the first aid level, depending on the industry and the safety culture within that client and how well we are tied with them culturally. But we see the opposite in client or in companies who are not utilizing a service. So they might have 80% of their injuries going really to clinics, going into the workers' comp system for medical treatment beyond first aid, even for very minor injuries. And so that's a huge disparity, which potentially can affect the outcome. One, delayed return to work, higher expense, and all this is really not necessarily what I would call beneficial to the injured employee or to the company because, well, for a number of reasons, but I'll kind of dive into this slide here. So, if an injury does occur, it's really critical to have as early as possible, we call it the critical hour, where if someone is injured at the workplace, if they can engage medical assistance and triage, that's absolutely critical. A lot of data we have internal shows that if there's a delay in reporting an injury by even a day, the risk of that becoming an OSHA recordability needlessly increases by 60%. And so, again, as soon as something happens, you should quickly determine if this is an emergency or not. If it is an emergency, you want to quickly call 911. But additionally, you can actually engage our service too. We can provide assistance with liaisoning between the emergency department and the company for specific reporting, things like that. Again, if it's not an injury, that's where a huge value of our service or service like ours is absolutely critical. And what happens is the expertise that we provide can quickly determine if something is severe and needs to go into an urgent or emergency room or an occupational medicine clinic, or if it can be managed at the first aid level remotely. And so we call one of our views of this is good medicine is good business. So we quickly determine if an injury is, again, mild or minor, or if it's severe. And then obviously there's sometimes gray areas, which is where our expertise can provide a lot of judgment and insight into what to do next. And so again, a lot of things, maybe the majority of injuries can be kept at the first aid level remotely. Again, if not, then we will get them into a clinic for a second opinion. And, another major important factor for this is timely reporting to the organization. And so we are looking to make sure the appropriate people and stakeholders within the company are notified about the injury and disposition of that injury. And Dara, let me know if I missed anything, or Holly, that you'd like me to brush up on.
No, good, Scott. One thing, we had a question from the audience that I think kind of fits into thinking about this. Debbie asked, she said that they experienced some clinics referring injured employees to PT on the same day of the injury. Is this beneficial to the injury within the first few days before applying first aid measures, or what's your opinion on physical therapy in the course of treatment?
Can you repeat the first part there? I had a little bit trouble hearing you, sorry.
They experienced some clinics referring injured employees directly to physical therapy the same day of the injury. And just talk us through the difference between referring to physical therapy versus applying first aid recommendations at the time of the injury.
Oh, I see. Yeah. So, every case is different. Our experience is a lot of, or the majority, or I would say even a majority of cases can be kept at the first aid level. So, but it really depends on a number of factors like the nature or the mechanism of injury, and even the personal medical status of the injured employee. Those can all dramatically affect how an injury is managed. Some clinics do heavily use physical therapy right away. And so, I think it takes some judgment. That is not necessarily our approach for every injury, is to refer to physical therapy. So I think you do want to have some oversight and to make sure physical therapy isn't necessarily overutilized. For if every injury is going to physical therapy, that may not be, that may need to be looked into potentially.
Well, and it becomes a recordable injury immediately at that point. Yes. That's a problem. Yeah. Talk to us about why first aid measures work, because I think that a lot of times we get stuck in this thing where it's like, oh, first aid measures. But do we know what the first aid measures are and why they actually work? Scott, we don't talk a lot about that. So tell us what these are, what they're doing, and why they actually work. Why is it that these will work as opposed to necessarily needing to take everybody to a clinic?
Well, and again, before I dive into the specifics, when you just look at the distribution of injuries, it just on population data, it holds that the majority of injuries are going to be not severe, and so usually not needing physical therapy or medical treatment beyond first aid if you have an effective, efficient management approach to it. And so I think a lot of times first aid is actually heavily discounted in the sense of people don't see it as value add, but it's really the most important thing for any injury. Even a severe injury should have first aid done immediately. The beautiful thing is most injuries are mild and really benefit from first aid. And so, some of the common measures that you see for first aid, the old acronym is RICE. Rest the injured or affected area. You're going to apply ice or some type of cold compress to the affected area. Also provide compression like a ACE bandage, things like that, and then elevate the affected area. And why, these are simple approaches, but why it's so effective is whenever there's an injury to the body, our immune system is going to quickly react and create a lot of pain, swelling, and immobility. So if we can help the body while it's doing this response, it dramatically changes the natural course of these injuries. So say, for instance, an ankle sprain, you can actually have quite severe ankle sprains, but say you just have kind of a garden variety one. If you do nothing to that ankle sprain and you just kind of continue on like if nothing happened, you can actually, the swelling will continue to the point where, you're really not, you can't even walk or prolong stands. So just, and that's what's so critical about that critical hour, so to speak, is if you can engage into some active management of that injury right away with ICE, with the RICE acronym, rest, ice, compression, and elevation, that will dramatically affect the time course by which that injury, that person probably may be fully recovered in a day or two, whereas if nothing is done and they persist through it, that may go on for a week, or it could even become chronic. And so, these first aid measures are really important. And then really over-the-counter medications are quite effective for pain control if the pain level is, at the appropriate level that needs some type of pain management. So, really there's so much value in, again, having good first aid measures, for all injuries, and then considerations for first aid, obviously local first aid is great by coworkers or a supervisor. A service like ours obviously provides a much higher level of service. And, I think what's important to kind of convey is a service like ours can dive into past medical history to make sure if they're on any medications that would or have a past medical history that would dramatically affect the natural course of this injury, or it may change how we actually disposition the injury, maybe more severe than otherwise thought of in case they're on blood thinners or some type of other medication or medical condition that makes them at higher risk than what you would have thought otherwise by a non-medically trained person. And then, I think obviously we always want a good rapport and buy-in by the injured employee about the recommendations. And then follow-up is absolutely critical. We want to make sure that these injuries are improving over time, making sure they're not getting worse. And, because obviously every case is different and, things potentially may get worse. So we may have a second opinion on that matter, et cetera.
Okay, thank you. Yes. The part about monitoring, that's such a huge piece. And I'm so glad that you said that, Dr. Cherry, because that piece is where things really get lost sometimes there. We've got lots of good questions before we start in on a COVID update. Let's see, there were several that came in about OSHA recordability that were in here. Some that were asking about RICE. Carol asked a good one. If you require rest, would it make it recordable since they cannot perform their duties?
Correct. If there's a limitation by a medical provider, that would consider it recordable.
Mm-hmm. Yeah.
So I think usually that means that the medical provider has issued restrictions, right? Written restrictions.
Correct.
For rest.
Yes.
Taking a couple
Correct.
of minutes to rest your ankle if you're working would not be considered restrictions placed on the employee, right?
Correct.
Right.
Mm-hmm.
Well, and that first day doesn't count also too, right? Dr. Cherry, the first day, the day of the injury, that one doesn't count towards your log too.
Correct.
If they did not work that day. Yeah. Okay. All right. And then let's see, is there a difference? Oh, here's a really good question. Hey, and her name is Holly, just like mine. All right, Holly, here's your question. Are there noticeable differences in active injury management in the different age groups? That's a really good question.
Okay, repeat that again, Holly.
Are there notable differences in active injury management in the different age groups?
Are there
so with your younger population, would you treat them maybe a little bit differently than what you would with your older population?
Interesting. I think that's kind of the art of the practice, right? So, there are standards of care for first aid and treatment beyond first aid. And so you do have individualized care for each person, right? And so I think, if you're just doing first aid on site with an untrained person, you're gonna kind of get kind of a limited service approach. A service like ours is much higher level of service, and so obviously, everything is taken into consideration with past medical history, demographics, things like that. But definitely, and I think healing times potentially are affected with age and a host of other things as well.
Yeah.
Scott, I agree with that. I think that I don't think the treatment is different, Holly. But the fact of the matter is the older worker is going to take longer to heal and to recover before he or she can return to work. So.
Yeah. Really good responses. Patrick had asked, how do you combat employees with pre-existing injuries that you are unaware of and the pre-existing injury worsens due to something work-related?
Tomm, do you want to take that? I know you have some approaches to that with your service, but if not, I can take it.
Well, yes. Most pre-screening strength evaluations can help to determine if you're hiring someone with a pre-existing condition that may contribute to an injury down the road. I mentioned earlier, perhaps, that we do new hire physical capability strength testing using isokinetic equipment. We only test two joints, shoulder joints and knee. But you can see very objectively when you do an isokinetic test, you get a force curve pattern out that looks like an EKG. And we know what a good force curve pattern or a normal force curve pattern should be for the shoulder or the knee. And if a person has a pre-existing condition, that force curve looks dramatically different. And legally, that can come into play as to determine if he or she can safely perform the essential functions of the job. Doesn't necessarily mean you disqualify the individual, but you don't, and if you bring that person on, you don't put them into the job that's physically demanding, that's going to cause further injury or worsen the pre-existing condition. In some cases, it disqualifies the person. And again, legally, you can do this.
Holly, can you hear me okay? I think there was
I can hear you.
My microphone wasn't picking up as easily. Now, Tom's taken me through those paces before, so I've done the test that he's speaking about that measures strength, which was one of my favorite experiences over the years. So I know that a lot of people have asked these questions, but it is quantitative data, and there is no hiding. So when he takes you through the paces, you're putting out an effort to show strength, shoulder strength, and another joint strength through the experience, and you're not hiding it. You're not faking something. I'm not faking a squat or faking movement. It's really interesting. And if you are somebody that thinks you're strong or you think you're doing well, this will definitely put you in your box. I was surprised at how much work I still had to do to strengthen my muscles.
And Dara, you did quite well too.
No,
I did okay. I think I'm stronger now. I want to retake.
She wants a redo. All right, we've got 5 minutes left, and so Dr. Cherry, I'm going to come to you and ask if you could give us a quick COVID update. We did have the poll in the very beginning, and so these were our results. So it looks like that about 35% of people said that, yeah, they know somebody that has COVID. What's going on with COVID right now? Yeah.
Yeah, I kind of anecdotally if I was to answer the poll too, I felt like I've seen or heard a few friends in my kind of friends and family network talking about they have COVID or someone, does. And, obviously COVID has kind of gone into the back of our minds from its, during the pandemic highs, obviously. And so I did kind of look up recently kind of what's kind of the current state as best as we could look at it. And one of the metrics that I like to look at is called the test positive rate. So if you end up getting a COVID test, what percentage of those are positives? And so, this can vary dramatically, but at the beginning of summer, the test positive rate was, in the low 20%. So if 10 tests were given, 2 were positive. Now I looked at it this last week or two, and it's doubled up to about the low 40s. Obviously, the volume is significantly lower than what it was during the peak epidemic component of this, but that's a significant increase. It gives us some information. It's kind of incomplete. I also like to look at severity. So you look at hospitalizations and deaths. And so when we look at the hospitalization data for the US, this week, there was about 9,000 hospitalizations. And again, this is across all of the US. So although that may seem like a big number, just take in consideration, it's all of the US, but relative to the week before, it's about a 12% increase. So I think that's what's more important to realize. So, about another 12%, so that's something to pay attention to, because that's what drove a lot of the policies potentially was the concern about overwhelming the medical systems across the country. And then lastly, deaths. And so deaths are kind of stable at about 1% of deaths right now are attributed to COVID, and that hasn't changed. And so, the data right now is telling us that probably infections are probably going up a fair amount. That could be potentially, confounded by a few things with that test positive rate data, but the hospitalizations help kind of confirm that to a degree. So test positive rate doubled, so 100% increase, and then hospitalizations increased by 10 or 12%, and so that just gives you a sense of right now, there probably is some COVID activity out there, and to be aware of that. We do get complacent over time. That's just part of human nature, but it is something to kind of be aware of.
Yeah. So from an employer perspective, so we know that the cases are rising. They're obviously not at the levels that they were before, and that this is a fast variant that's spreading quickly. So what would your recommendations be for employers specifically? Would you stay around, just really reiterating the importance of washing hands and some of these infection prevention practices, or what would your recommendations be for employers right now?
Yeah, maybe send out kind of some of the general recommendations you had for COVID with, personal hygiene. I think one of the big aspects is coming into the workplace sick. I think, that was always an issue, and it probably was a badge of honor that, you come into work sick, but this might be a time where you kind of really empower the culture of the organization to say, if you're sick now, it could be a number of things, right? It could, but again, if a bunch of people get sick, it can dramatically affect, the workforce. So I think that's something that, is kind of an unforced error, right? Getting your coworkers sick. And then just like what we've been talking about for even injury prevention, optimizing your health is helpful for injury prevention, physical, mental, but also for if you do get an illness like COVID. I think there are a lot of studies that show the healthier you can be pre-COVID infection may help the outcome of your the natural course of your COVID infection.
Wow. Okay. And Leslie said to let us know that, let others know that you can get COVID twice in a month. Oh, Leslie. Wow.
Wow. Interesting.
Oh, man, that's rough. That's rough. That is rough. Well, thank you all for joining us today. Again, if you haven't already, please make for sure and click that button to get registered for the session with Dr. Les Carté. He always does an amazing job as well, talking through imposter syndrome. We appreciate your attendance, and we look forward to seeing you next month. Thank you again.
Thank you.